I'm going to instruct you in the exercises we will teach you following your surgery. The first 3 exercises are called anti-embolism exercises, which are typically exercises to prevent blood clots. Those include forceful ankle pumps, which will have you move your ankles up and down forcefully 20 times each waking hour. The next exercise is called a quadriceps set. And what you will do there is push your knees straight down into the bed in order to contract the quadricep muscle and get the blood flow up to your heart. The third exercise you will do is called a gluteal set, which is squeezing your gluteal muscles in order to increase the blood flow up to your heart. It is important that you maintain your hip precautions during stand to sit and sit to stand for 6 weeks following your surgery. We will instruct you on how to place your operated leg forward so that you open up the hip angle prior to standing, such as this. You will do the same process when you go to sit in the chair by placing your leg forward in front of you. The next exercise you will perform is a heel slide, which involves sliding your heel up in the bed in order to flex the hip and the knee. After a hip replacement, it is important that you perform this exercise lying flat in the bed so as not to exceed your hip precautions. The next exercise you will perform is called supine hip abduction. In this exercise, you will slide your leg out to the side in order to work your hip abductor muscles. The next exercise will be for knee replacement patients only because it is contraindicated for those who have had a hip replacement. It is called a straight leg raise and is performed by lifting your leg straight into the air from the hip in order to strengthen your hip flexors. The next exercise you will perform is called total knee extension over a roll. You will place a towel roll underneath your knee in order to strengthen your quadriceps by extending the knee. This is the only time you will place a roll underneath your knee following knee surgery because it is contraindicated otherwise in order to prevent a flexion contracture. These exercises you will perform in sitting. They are designed to work on knee range of motion as well as knee strengthening. The first exercise is extending your knee in the sitting position and holding for 3 seconds to strengthen your quadriceps muscle. The next exercise you will perform is knee flexion. You actively bending the knee back to obtain as much range of motion as possible. This exercise is most important for total knee replacement patients. We hope you found these physical therapy videos useful. If you have any questions or need any more information, please contact your total joint nurse navigator.